Hi friends, welcome to the biologist. Today we are going to discuss immunoelectrophoresis. What is immunoelectrophoresis? In immunoelectrophoresis, antigen mixture is first electrophorized to separate its component by charge. Troughs are then cut into agar gel parallel to the direction of the electric field, and antiserum is added to the troughs. Antigen and antibody then diffuse towards each other and produce lines of precipitation where they meet in appropriate proportions. Immunoelectrophoresis is used in clinical laboratories to detect the presence or absence of proteins in the serum. A sample of serum is electrophorized and the individual serum components are identified with the antisera specific for a given protein or immunoglobulin class. This technique is useful in determining whether a patient produces abnormally low amounts of one or more isotypes characteristics of certain immunodeficiency diseases. It can also show whether a patient overproduces some serum proteins such as albumin, immunoglobulin, or transferrin. The immunoelectrophoretic patterns of serum from patients with sample myeloma show a large amount of myeloma protein. Because immunoelectrophoresis is strictly qualitative technique that only detects relatively high body concentration greater than several hundred microgram per ml, its utility is limited to the detection of quantitative abnormalities only when the departure from normal is striking, as in immunodeficiency states and immunoproliferative disorders. This is how an immunoelectrophoresis processes. Antigen mixture is first put in the wells of the casting tray. Diffusion of antigen across the gel crossing to their relative charge site. A trough is created parallel to the length of the electric field. Trough is then filled with the antiserum. The antibody molecules diffuse outward. Diffusion of antibody molecules outward from the trough into the gel. Antibodies from complexes um, with the specified antigens forming arcs. Formation of precipitation arcs. A relative quantitative technique, rocket electrophoresis, does permit measurement of antigen level. In rocket electrophoresis, a negatively charged antigen is electrophorized in a gel containing antibody. The precipitate formed between antigen and antibody has the shape of a rocket, the height of which is proportional to the concentration of the antigen in the wall. One limitation of rocket electrophoresis is the need for the antigen to be negatively charged, which is a requirement for the electrophoretic movement within the agar mixture. Some proteins, immunoglobulins for example, are not sufficiently charged to be quantitatively analyzed by rocket electrophoresis, nor is it possible to measure the amount of several antigen